Hi everybody. On this film, I'd like to discuss a little bit about the lower airway and help people distinguish what's what. Oftentimes when learning about the lower airway, we hear about the trachea and then we'll hear something called the bronchi and then we'll hear something called the bronchioles. I just wanted to point this out that the bronchi right here is actually the plural form of, that's a horrible plural, but we're going with it. But it's the plural form of bronchus. That's all there is. And I'm going to show you what the bronchus is. But when you hear bronchi, it's actually referencing plural, multiple bronchus. And then when you actually hear of this term, bronchioles, it's just the plural of bronchial, which should be pretty simple to understand. But I do know, and including myself when I first started, I got a little thrown off by this. So sometimes when we talk about the lower airway, we may get thrown off because we hear the terms bronchi, bronchioles, bronchus, or bronchial. Just know that this is just talking about singular and plural form. Now, getting into the lower airway, a lot of times it's compared to a tree, but inverted Y. So here's your tree, and then in your tree you have branches, right? And those branches come up and out, and I'm not a great artist, but just bear with me if you will. And then some of those branches will have smaller branches, and that should be smaller, right? But they have smaller branches and smaller branches and smaller branches and so forth. And it looks like a tree. Then at the very end you have all these leaves, which are known sometimes comparatively or in the example as alveoli. So let's look at this. Let me show you this. This is a model of what the lungs or the lower airway system looks like. And let's talk about this inverted tree. If you can see what I just drew, if I come back here, kind of, use your imagination that the tree is now upside down. If we focus in on this, and if I remove these cartilage rings, you're going to see that the tree has a trunk. This trunk is known as the trachea. Right here, this portion is the trachea, and this is the windpipe. It's found, well, basically in your neck, in your throat, and when you feel someone's neck, you'll notice they have two pipes, the esophagus and the trachea. The trachea is in the front, or the anterior portion, and this is the windpipe. People breathe in, they breathe in air, and it comes down here to this portion known as the carina. Okay, now the carina, I personally refer to it as the fork in the road. But the reason why that's important to know is because it's more or less in line with the fifth vertebrae, and that is important to know for intubation purposes for paramedics in the field, because generally when we intubate, we don't want to go down into the carina, we want to be just above it. So when we breathe the patient, oxygen will go down into both lobes of the lung. Now, coming back here, like I showed you before, we have this called the bronchus, or the bronchial, or the plural bronchi, and the plural bronchioles. If you don't understand that, take a moment, pause the video, and think about it. But coming back here, if I get rid of these rings, this is the bronchus right here. Okay, let me get rid of this as well. But we look at this, and this is the bronchus, or if we talked about both these, this is the bronchi. So it's kind of the first branch in the tree, if you will, if it branches out. Okay, and then you do have a primary bronchus, you have a secondary bronchus, and so forth. But eventually the principle is it just keeps going down, and it gets thinner and thinner and smaller until it reaches something called the alveoli. But staying focused on bronchus and bronchial, or bronchi and bronchioles, is that we will eventually come down here, and then we branch. Let's look at this. If we bring this in just a little bit more, excuse me. And then we will branch into another bronchus, and then we get kind of down into these portions here where we get to bronchioles, and at the, figuratively speaking, there would be, if we could see them, little sacs, and most of the time people will compare those to looking like grapes at the very end. But those are noticed as your alveoli, but those are microscopic. So this model doesn't show that, but if you look on anything like on Google and image it, you'll notice that there are supposed to be little sacs grouped together, and they look like grapes. And that is the alveoli. And that's where most of the gas exchange takes place, almost all of it actually. It's the most efficient portion. So this has just been a quick review of the lower airway on all this. I hope it made sense. Remember, when you get into class, or if you get into discussions, or you get into a test, that you're talking about bronchi and bronchius, which is just plural and singular, and then you got bronchial and bronchioles. The way that I remember it, as we go down the tree, the farther we go, the longer the word will get, generally. So if it's in the plural form, bronchi, it starts at the top. Bronchioles, we get further along, the word is longer. So I hope that helps, and we'll see you in the next video.